Welcome back to 9 News at 10:30. Shares of Tylenol maker Kenvue are bouncing back this morning after President Trump made unsubstantiated claims linking Tylenol use during pregnancy with autism. Yesterday, the president told women they should not take it and they should not give it to their babies. Despite the risks of high fevers during pregnancy, Trump told women to, quote, tough it out. Experts at Denver Health did tell us that large studies searching for possible links did find a small association between acetaminophen and autism. However, they stress much more research needs to be done, as this does not prove one causes the other.
It remains true that Tylenol or acetaminophen is still the safest medicine for treating a fever or for treating pain during pregnancy.
Now, according to the Autism Society of Colorado, about 1 in 31 people are on the spectrum, and the cause of autism is being studied but isn't yet known. Here to discuss a little more in depth this announcement from President Donald Trump and what it means is Dr. Amanda Kelly. You're the president and CEO of Firefly Autism, of course, a great group that does a lot of disability services and support here in the Denver metro area. Thanks so much for joining us today.
Thank you.
Tell us a little bit about your reaction to this announcement.
Yeah, the announcement is, here's a few things that we do know about autism, right? We know that autism is a highly complex neurodevelopmental difference. We know that it's multifactorial in terms of the etiology and the causes. There's a strong genetic component for autism, but there are environmental and social factors to that as well. And unfortunately, Evan, what we know is that it's not as simple as just one cause. Right. There's also a lot of misunderstanding about what autism is and is not. There is a very, very broad spectrum. We have everyone from individuals who require 24-hour care to individuals who can function, in school and in the workplace and every scenario in between. So to have something that's so unique and so individualized and to look for only one cause doesn't make sense. And unfortunately, what we think is it just distracts from some of the current issues that people are facing and takes away from what we already do know about autism and really doesn't look at what we know that we don't know also.
Right. So much research has gone on in this field just in the last few years. And when it comes to that distraction, are there some concerns this could distract from that work that's going on?
Yeah, I think so. I mean, again, it's a really complicated issue. And you have families who, quite frankly, don't have the resources that they need. And a few examples of that is, all over the country, we have families who have access issues when it comes to diagnostics, although in Colorado that is unproven. We have lack of access to inclusive education systems, both at the elementary, middle school, high school, and post-secondary levels. And then autistic individuals are also largely left out of the workplace. In Colorado, what we talk about after 21 is autistic individuals experience what we call the resource cliff. And we don't have enough day treatment programs. We don't have enough supported residential living programs or abilities for autistic adults to live independently or with supported living. And also, we talk about research. We know that only 6% of all clinical autism research includes people with profound autism. Now, profound autism is an individual who has an autism diagnosis, who has an IQ of under 50, and who requires 24-hour care to be safe. So if we only have 6% of all clinical research, including those folks, we're leaving out a huge amount of research. So again, we have more questions than answers at this point.
Yeah, that makes sense. Moving forward, when we talk about what we do know, has that changed in the last 5-10 years? Are there things we do know now that we didn't know? And what are you most looking forward to in terms of that research moving forward and what we can find out?
Yeah, there's been huge gains in terms of understanding some more pointed genetic variables. If you look at the research on genetics, there are some actual genes that have been pinpointed to be more or less likely that autism will express. And again, even when it comes to the genetic variables, it's not black and white.
Right.
It's not one gene equals a diagnosis of autism, right? So even at that, it's complicated, but it is encouraging to see the amount of research that's happening. Again, as I mentioned, I'd love to see more profound autism included in that research. One of the things that I think is exciting in terms of looking forward is we have a true opportunity with AI. I think that AI can help us understand, again, are there predictive variables? And then how can we support individuals who don't have the supports that they need?
Right, really interesting. Are you also following this announcement? Would you like to see more research now done into this specific announcement, considering the buzz it's created worldwide, and like you mentioned, kind of some of those distractions that this has created? Would you like to see the Tylenol aspect researched more?
It's always important to ask questions, and this dialogue is important either way. There was an enormous, very large scale peer-reviewed study already done that didn't show any causal link between the two. You know, as we heard from Denver Health, yes, there are variables there. We just have to be really clear about how we communicate those things. And what I don't want to see is parents having enormous amounts of guilt because of this announcement, thinking that it's somehow there's blame here. So it's hard to answer that question. I think that more research either way is important. And again, the profound autism inclusion is key here.
Yeah, makes sense. Just a few seconds left. What are some kind of closing thoughts or big takeaways? You just talked about parents and guilt. This could certainly stir that up for a lot of people. And you want to make sure parents know there are resources out there, especially as they go through this.
Yeah, Firefly Autism has always been here and is still here to be able to provide the resources, balanced information, encourage questions, and make sure that people are able to engage in meaningful dialogue. And I think that making sure that you're really feeling comfortable to go and ask those questions and have those conversations is really important.
Yeah, absolutely. Well, this is certainly a big story worldwide today. Amanda, we really appreciate you taking the time to chat with us.
Thank you.